Hi, this is Heidi Nelson, and welcome to this edition of Duffy Doings, our show about issues relating to healthcare and homelessness on Cape Cod and what's going on at Duffy Health Center. Today we're going to talk about something called the Coordinated Entry System, and my guests with me here today are Paula Schnepp, who is the coordinator of the Regional Network on Homelessness for the Cape and Islands. Welcome, Paula.
Thank you.
And my colleague, Pat Cawley, who is the Director of Case Management and Integrated Services at Duffy Health Center. Welcome, Pat.
Thank you.
So for the past 25 years or so, the federal government department called the U.S. Department of Housing and Urban Development has really placed some structure around how communities use the HUD funding in order to end homelessness in local areas. And the way that these structures are called continuums of care, continuums of care is what we call them. And really what they're all about is making sure that there's a structure for the HUD money to flow to the communities based on what community priorities are. But the continuums are also a place where participants can coordinate services and come together to collaborate to improve services for people who are homeless. In recent years now, HUD has developed this concept called Coordinated Entry System, which is really trying to, for two main purposes. One is to make sure that the people who really need the services are getting the most needy are getting the housing the most quickly, and that there's a really fair process between and among the agencies. So it creates a structure for the agencies to collaborate. So Paula, you're our regional network coordinator for the Cape and Islands. So tell us more about the regional network here for the Cape and Islands. How did it get started? Who participates? And what are some of the committees of the regional network?
So as you've already pointed out, the HUD funding that has been available to serve homeless individuals and families has been available for over 25 years. On the Cape and Islands, we had the opportunity to create our own network or continuum just over 20 years ago so that we could apply for this funding. And to date, we have received probably over $25 million to the Cape and Islands to provide housing and resources for homeless households. So the continuum or regional network has been in existence for 20 years. About 8 or 9 years ago, the state also got involved in providing some funding specifically to target homeless households or those at risk of homelessness. So that created another sort of structure to our activities on the Cape and the Islands. So the organization itself is made up of agencies and local government officials who all have an interest in helping with solving the problem of homelessness. And we have a policy board that meets 6 times a year that provides sort of our governance of this effort.
Right. Okay, and committees, are there committees of the regional
so we
network?
Have,
we organized around different populations, I think, or how are we organized?
And again, HUD often directs a lot of the way that we end up doing our work. And a number of years ago, they put out a strategic plan to end homelessness and sort of grouped the homelessness into 4 categories. One, the chronic homeless, and the chronic homeless are individuals who've had long histories of homelessness and have a disability.
Okay.
Families, veterans, and youth. Okay. So we have organized our efforts to try to deal with the issues for those populations. And right now we've been most active in trying to help those who are chronically homeless, and we've just reintroduced our committee on family homelessness as well. Okay. We also do work that's sometimes more task-oriented, so we've had some forums for veterans and for youth, and we also have been working on certain geographic populations, Hyannis and one in
Right, on
particular.
Main
So we were
Street.
doing Main Street and outreach efforts.
Very good, very good. So now we have this new project called Coordinated Entry. So what does that look like here in our region, and what do you think is going to be the impact of having coordinated entry on the Cape?
So as you said, the coordinated entry system is a requirement now of the funding that we receive on an annual basis from the federal government. And it's an obvious thing to try to make sure that money that's coming into a region is available to all those who might qualify for it. But how that actually occurs is often a fairly significant challenge, especially since the funding that has come from the federal government was given to various agencies or grantees, and often for a specific population. So a lot of these, what we call legacy programs, have been in place for 15, 20 years.
Oh, interesting. What's an example of that?
One of the programs is actually called Housing First, and it serves a population that has HIV/AIDS and has been individual or homeless.
Okay.
And that was one of the first programs funded through this McKinney-Vento money,
Right.
and 35 households have been, per year are served with that.
I see. Okay.
So there's been a process in which individuals who have that diagnosis and are homeless kind of go through a door and get into the housing that's available. With the coordinated entry system, we're sort of saying we need one system where anybody who finds themselves to be homeless and in need of housing can come in, get assessed by a common tool, and then determine how vulnerable they are, how needy are they, and which housing can they be matched to. So it's, instead of having these separate silos of housing dollars and programs, we now have sort of one process in which people can come to and go back out to the housing that's available.
So in the past, a client might be on the Duffy list, they might be on the Housing Assistance Corporation list, they might be on the VinFen list, but now the idea is to be on one list.
That's right. And so we actually have created a database in which all those individuals who have been assessed are on the list, and they're ranked by their vulnerability and their need for housing.
Okay. So Pat, at Duffy, our case managers have always been really good about collaborating with community partners and working really well with the various housing organizations, and we provide case management to people in their housing to help them stay in their housing. So how is coordinated entry going to be different for Duffy Health Center?
Well, for the case managers at Duffy, as Paula mentioned, there's an assessment, which is new for us. It used to be that Duffy would work with Duffy patients and find housing for those folks. But now there's one centralized list for the patients and one centralized list for the housing. So we work with our clients to do the assessment and get them onto the list, and then we wait for a match. A third party does the match with the information from the housing resources that are available and how people have prioritized in the list.
Oh, interesting. Okay.
So in some way, it has taken away the control that we used to have, but it's made it a more transparent and a fairer process. And it really enables those folks that might not be in our little inner circle of the agencies that we work with to really get a foot into the door. So one of the things, additionally, that Duffy case managers are doing, they're also available to do this assessment for people who aren't Duffy patients, because we want to get as many people in that need housing to be able to really look at them and figure out what their needs are.
Right. Okay. Okay. So let's take a step back for just a minute and talk about case management, because case management is a term that kind of gets thrown around a lot. It can mean a lot of different things to a lot of different people. Nurses do case management, and case managers, you know, in our world are people often with lived experience of homelessness, or people who have worked with homeless people for a very long time, or people who have a degree of some sort in a helping agency, but in a helping field. But what are the essential elements of case management from your perspective?
At Duffy, we have case managers, and what they do is really manage situations. When you look at case management, you're looking at both the client and the environment that they're in. For Duffy, the environment is the medical center and also outside. So it's really the case manager's job to coordinate between the patient, the medical needs that they have, get the help that they need, whether it's medical or behavioral health, and also what resources are out in the community that are available to them. So case managers can provide support, guidance, a lot of advocacy, and there's a lot of detective work that goes into case management as well.
Give an example of that. What do you mean by that?
You may assess a client and think, okay, this person needs this because you've worked with somebody else before and this has worked. But then you find out, no, that's not exactly it. I talked with the case managers today just to get a flavor of what they were doing. One person was trying to help somebody get into detox. So it's calling up the detoxes, the detective work is in that of where is the bed available? Which detox, if there is a bed available, would this person work better with? You know, who has the aftercare program? So it's really knowing all of the resources. I had a gentleman walk in whose eyeglasses were broken. So how do we get him to get his eyeglasses fixed? Another case manager had a couple of phone calls where she felt what she really did was listen to people and help them like sort out where they were. Didn't do a whole lot of active things, but listened to somebody and validated where they were in their process of making some changes.
So it sounds like a lot of day-to-day kind of on-the-spot helping and decision-making, but one of the things that I think is important also to emphasize is that there's a professionalization of the process, right? That we really do need to assess the person to find out what their resources are and what their deficits are. And then creating a plan for that person and then kind of monitoring and helping that person through that plan. Would you agree that that's the process for case management? And I'm always just very proud, I think, of the training that you provide and the leadership as a licensed clinical social worker for our case managers to help them through those thorny clinical issues as well.
Yes.
Okay. All right. So we also have kind of, I guess I would call it different kinds of case management. So can you talk about the different kinds of case management services that we offer at Duffy?
Sure. As you mentioned, Heidi, there's the assessment. Everybody, it starts with an assessment. You need to know who and what you're working with in order to make any changes. The way we look at case management at Duffy is we have different types of case management, but it all begins with person's basic needs. We're looking at Maslow's hierarchy. If somebody doesn't have a place to put their head at night, is hungry, is sick, we need to take care of those things.
So the basic needs are the most important.
Right. So we have some outreach case managers who work out in the community and meet with folks, with our partners from VinFin and from the Housing Assistance Corporation, and also the police, to really work with those folks to get them what they need. We also internally have what we call the case manager of the day. And that's for somebody who's walking in or who needs some help, we can help that person. I look at case management in two different ways. The one is called the brokerage case management, where you're brokering for services and you're making a referral and you're getting somebody some help. That's usually short-term and not really based on building a long-term relationship with the person. Our other case management programs are really based upon building the relationship with the person. And that's by using motivational interviewing during the assessment to really help that person tease out what his or her goals are and what they want to change in their life. So
we've talked a little bit around the edges about something called Housing First. Paula, from a systems perspective, what does Housing First mean to you?
Probably the best way to explain it is to say what it's not. So traditionally, the theory was that somebody who became homeless needed to spend time in a shelter and graduate to transitional housing where they could learn skills, maybe skills that like to live in housing or to get work or go back to school. And then the next step would to graduate into permanent housing. So there were sort of some expectations and hoops to go through. As most of us are aware, there's some individuals that homelessness is a result of many variables in their lives, and some of them have to do with substance abuse and long-term mental illness, many things that make it difficult for someone to engage and be motivated to make progress through a, you know, expected pathway. And yet those individuals are often the most vulnerable and the most in need of some type of support. So this whole model paradigm was sort of turned on its head, and the thought was, well, why don't we give people housing first, no matter what their circumstances are? You know, whether they're still, you know, actively using a substance, whether they have or haven't engaged in mental illness treatment. Let's get them housing, let's get them stabilized, and wrap around services so that the engagement process can either begin or continue, with the hope that the person might make some choices that would help them, you know, in their recovery. But at the same time, their housing was secure. And the only reason that the housing would go away is if they were to behave in a way that any other tenant would behave and not pay the rent, or not, you know, live in their housing in a quiet and stable manner, so that, you know, you're treating everyone like an adult and giving people responsibilities, but giving them that basic, you know, hand them the key and said, this is your apartment.
Right. And it sounds counterintuitive. You know, you have to look at the research and look at the data to see that it has been proven over and over and over again that a person who's homeless, their basic need is that they need a house, right? And that's the place where you start to work on some of those other issues that have created problems for people in maintaining stable housing.
And I think the argument that advocates who came up with this model used to say, hey, let's give this a try, is that it's extremely costly for homeless individuals who have several health issues to cycle in and out of our healthcare system.
Right.
So I think
not to mention jails and
other institutions, right? So that it's been established that it's actually a much more cost-effective for society to have people in housing, even if they're still, you know, actively using.
Right. So Pat, what does Housing First look like at Duffy?
Well, Heidi, we have 2.5 case managers who work with our Housing First folks. And we have about 45 clients right now that we're providing those services to. Our case managers meet people when they're homeless, out in the street, and build trust with them by meeting their basic needs. Again, it's helping somebody get into a shelter, assist them with getting the documentation. Even though we say housing first, people still need to prove who they are. We need birth certificates, we need identifications. If they don't have any income, do they have any disabilities, that we can refer them to get some assistance. So in the beginning, the case managers are really working around all of those things and hoping and waiting for a housing voucher to appear. And that is an issue on the Cape, affordable housing. Once a voucher is made available, the case manager, again, does some detective work, calls up some landlords that we have relationships with, goes through the newspaper, not so much the newspaper anymore, but online looking for housing, and calling up the landlords, and with the client's permission, explaining the situation a little bit, and kind of brokering the deal of getting somebody some housing. A lot of work often goes in with the client, because if somebody's been homeless on the street for a long time, they've developed survival skills to live on the street. Those are not the same skills that are going to make them be great tenants. So there's a lot of education around that, and a lot of trial and error. For instance, if somebody's been homeless for a long time and they have friends who are still out on the street, it's a normal thing to want to invite your friends in. But what that can look like in the neighborhood is the shopping carts appear in front of somebody's apartment. And to let people know that they can have company and guests just like anybody else, but their guests need to follow the rules like other people's guests do. Oftentimes, people who live out on the street don't have high expectations of what they want for themselves. So we help them find furniture, and usually their expectations are very low about what they want for furniture.
Well, and I was going to ask, it must take a lot of effort to move somebody from the street into an apartment, and I know we work with churches and other individuals to do that. To really help out and to get like what this person needs. Oftentimes when people first move into an apartment, they don't sleep in their bed. They sleep on the couch. They kind of make their way back to the bed.
And Paula mentioned that people may still be active in their addiction, and we have found that once somebody is housed and they have that safety, they're not so much in survival mode anymore. They can deal with their other issues. Many times we've been working with somebody for a long time, and it's not until they're housed that they actually come in for a medical appointment. Or we'll start talking to somebody about the voices that they're hearing or some other anxiety, depression that they're experiencing. We, from the outside, can see it, but the person has never really named it and owned it. So until they're housed, they're not able to really deal with those type issues.
A number of months ago, we had Joe Finn and Tom Brigham from the Massachusetts Housing and Shelter Alliance on the program to talk about their social innovation financing model, and Duffy and Housing Assistance Corporation partner in that model. Can you tell the folks about what social innovation financing is?
Social innovation financing, or SIF, is a public-private partnership. And it's called Pay for Success, and the partnerships are developed to work on a social problem or a social ill, and thinking that if private money comes in, the public ultimately benefits, and it does. We're working right now with 13 other agencies across the Commonwealth, and it started in June of 2015. The hope was to house between 500 and 800 people using the Housing First model, and at the end of last October, October 2016, we had housed not just the Cape, but 369 people.
Wow, that's great progress.
On the Cape, we've housed 23 people. The HAC case managers have worked with the landlords and to find the housing, and the Duffy case managers have worked with the clients.
And our goal was 30, so
That's
we're
right.
almost at
We're
our
almost
goal.
there.
And we don't have to stop, right? At 30, we can we can keep going, right?
Yeah.
Well, that's very encouraging.
Yeah. Unfortunately, we did have a couple of people die, and then 2 have also, they didn't make it. They couldn't follow the rules for the tenancy, so they were evicted. And then we had one other gentleman who's currently in jail. So 18 of the 23 still remained housed.
So it's still kind of fluid.
It's fluid, right.
So Paula, we are in the process of implementing coordinated entry. So where are we at right now? What has been accomplished, and what more do we need to do to make coordinated entry a reality?
So on December 1st of last year, 2016, was basically our drop dead date, so that any housing vacancies that are funded by the federal government through these programs has to be filled by a person who has gone through the coordinated entry system. That doesn't sound like a huge thing, but it is, right?
It is, and you've done a wonderful job collaborating with all of us to make it work.
Happen, so that everyone that is being assessed is using the same assessment tool, and that is what we call our VI SPDAT. I won't go through what the acronym stands for.
But interestingly for the audience, it's a vulnerability index are the first 2, you know, so the idea, and it was really invented in Boston, the idea of the vulnerability index, so it is a measure of how vulnerable somebody is out there on the street.
And this is a tool that is being used across the country. So it has a lot of, I think, best practice piece of it. So the assessment tool has been decided, you know, we're using a tool. We have assessment agencies, of which one Duffy is one. And we have hired a coordinator, a part-time coordinator, who is literally receiving the information from the people who've done the assessments and putting it into a database, and then seeing which vacancies are available in the programs and making matches. So those who score high enough are then sent over to those housing agencies. And you know, we're working through the process here. We're at our last meeting, discovered that a number of people who really are very vulnerable, but for whatever reason their scores are not reflecting that we needed a process in which that we could sort of either override that or provide some additional information to help move them along.
I see.
So that's been done. And we're doing MOUs, memorandums of understandings, with all the different agencies that are either providing the housing or doing the assessments.
So everybody's documenting what resources they have available.
So there's a lot of infrastructure creation, and you know, it feels sometimes like it's slowing the process, but I think once it gets fully implemented, that it will really not only provide us with more information about what's going on, but really get people into housing as quickly
even
as
being
possible.
able to share information about people and their health care.
Right.
There are laws about that now, and
Yes.
so you have to have agreements, right?
And authorization.
And the client has to agree that it's okay
Yes.
to share their information.
That's right.
And I know a lot of that hadn't been really sorted out yet, so we were kind of a pioneer in that perspective, right, on the Cape?
Well, we're one of one of many heading out to try to figure this out.
Yeah. Well, good for you. Good for you. What are some of the other projects of the regional network? What's going on with the regional network these days?
The one that we're really we have like three areas of focus for the network, and one is education, one is facilitation, which is, I believe, what we're doing with the coordinated entry system, and the third is advocacy. And our one of our prime advocacy issues this year is trying to get the expansion of the housing courts to the Cape and Islands. And we're very happy that all of our delegation, even our newbies, have signed on and sponsors legislation. The governor has it in the budget. So we're sort of in the next couple months trying to push that across.
And what would that mean? What does housing court mean?
So at the moment, anything related to housing, whether it's a hoarding issue, an eviction, all those types of housing related issues have to go through our district court. And the judges are usually handling more criminal issues or other civil cases. And so it's not very specialized. But in the rest of most of the rest of Massachusetts, there's housing courts, so the judge has a specialty in that. There's other resources that are brought to bear, tenancy preservation funding, which helps disabled people stay in their housing. And so there's just a lot that goes into a housing court that just is not available at a district court.
Right. Well, and just organizing all of the people that have to use the court. So if we had housing court here in Barnstable 2 days a week, then the attorneys who are working with people with housing issues could handle. It's much easier to manage your schedule when you know that there's the court is happening on Tuesday or whatever. What about Main Street? What's going on Main Street in Hyannis?
In Hyannis.
Every town has a Main Street.
Pat.
Okay,
take
I'll
that
say
one.
a number of agencies are involved with Main Street. We work with the Homeless Outreach Team, which is also known as the HOT Team from VinFen. The case managers from HAC, the Barnstable Police Department, the Civic Association, and the owners of businesses.
Right.
And it's a really concerted effort for the health and safety of the community, for tourism, and for targeted interventions for some of the folks who are on the green or out in the street.
Right.
So it's been a successful collaboration.
And a lot of
that's-
leadership provided by the Barnstable Police Department,
Yes.
and creating a new community service officer who are sort of plainclothes, generally young people who are doing internships or want to become police officers who come to the Cape and work for the season, if you will,
Right.
to help out on Main Street, and they've been a huge asset. So here's kudos to Chief McDonald on coming up with that brilliant idea. So hard to believe we've run out of time.
I know.
It goes so fast, doesn't it? But Paula Schnepp, coordinator of the Regional Network, thank you so much for being here with us today. And Pat Cawley, Director of Case Management and Integrated Services at Duffy Health Center, thanks for being with us.
Thank you.
And thanks for watching today. See you next time.